Hi, my name is Dr. Ibrahim Abd Elrahman and I'm here to give a talk and some information regarding fibroids. Fibroids are basically what we call monoclonal smooth muscle. They're just smooth muscle that have grown inside the muscle layer of the uterus. They occur in 70% of ladies. There's two main kinds of lesions that you can get in the uterus. One are fibroids, which are, as I said, benign. The others are the cancerous kind of masses in the uterus called leiomyosarcomas. Now, the incidence of fibroids are about 70%. The incidence of leiomyosarcomas are about 7 in every 100,000 women. So it's a really rare condition, and most ladies who have fibroids don't need to worry about them again. Fibroids are caused essentially by an overgrowth in the smooth muscle of the uterus. They are fed by estrogen, which every woman makes as part of her normal reproductive cycle. If you have early start to your periods, you have a longer lifespan with more estrogen, and therefore you're more likely to get fibroid. If you have more babies, every time you're pregnant, the estrogen is high, so you're more likely to get fibroid. There's a hereditary factor and there's a race factor. So if you're from sub-Saharan Africa, the Far East, the Middle East, and South America, you're much more likely to have fibroids. They say caffeine can contribute to it and alcohol, but these are sort of low risks. The risks of fibroids becoming cancerous is incredibly low. In fact, it's zero. Fibroids don't become cancerous. You can get another mass in the uterus which is cancerous. The risk of getting a cancer, or what is called leiomyosarcoma, in the uterus is about 7 in every 100,000 women. So the risk is incredibly low to have cancer. So if you have fibroids, cancer should not be the primary thing you're worried about. The main symptoms that you would get if you have fibroids, which are significant enough, if they're big enough to give symptoms, the main things you will get are pressure symptoms, if they're big, and heavy bleeding or bleeding between the periods or something like that. Basically bleeding problems because of the fibroid. They're the main symptoms. Symptoms of subfertility and things like that aren't really the biggest risk. Some ladies will get pain with fibroids, and that's very possible, but these are the three main symptoms. Now, if you have fibroids, there are lots of treatment options. The first one is you do nothing. If they're small fibroids, they're not giving you a problem and they're not growing, you can forget about them completely. If you want treatment for the fibroids, now you need to understand why you're having the treatment. The two main indications for treating fibroids are symptoms and abnormalities in the fibroid. The treatment ranges from symptoms to reduce bleeding. Now, these can be non-hormonal tablets that you take for a few days every month when you're having your period to keep the bleeding low, associated with painkillers if you're getting pain with the periods. You can have hormonal tablets such as a contraceptive pill, or progesterone type pills, which are one part of the contraceptive pill, and they work to reduce the bleeding. Now, there was another medicine we used to use called Esmia to shrink down the fibroids, but we don't use that anymore because that can affect your liver, so it's really frowned upon to use that nowadays. Having gone through the medical options, the next option is to consider radiological treatments, or basically treatments in the X-ray department for your fibroids. The radiological treatments are, the first is high intensity focused ultrasound, which is basically where you use an ultrasound machine, quite often in an MRI machine, so that you can see where the fibroids are, and you focus a beam of the ultrasound on the fibroid to fragment it and shrink it down to about half its size. This is not really available here in the UAE at the moment, but it will be coming. The other option is to have what's called uterine artery embolization. They put a small opening in the thigh, put a tube in through the blood vessel in the thigh, feed it around to the blood supply of each fibroid and block that off. So the fibroid dies from inside and again shrinks to about half its size. Both of these are excellent and give very good results, but it is not, according to current evidence, recommended for people who have not had a baby before because it may affect the uterine blood supply. Having said that, lots of ladies have had these and gotten pregnant and had babies afterwards. The next option is to consider surgery for the fibroid. Now, as I said, the main indications to have surgery for fibroids are bulk-related symptoms because of pressure and bleeding problem. There is no randomized trial. Now, randomized trial is how we work in medicine, where we want to find good evidence for something. There is no randomized trial that says removing a fibroid improves your fertility, that says removing a fibroid reduces your risk of cancer. So these things need to be taken with a pinch of salt. You can, of course, do these, but you have to understand the real reason you're doing the surgery. So if you're doing surgery, there are 4 options. 1, keyhole surgery to remove the fibroid. Secondly, open surgery to remove the fibroid, which really shouldn't be done very often nowadays. Next, you have keyhole surgery to remove the uterus, and then open surgery to remove the uterus. Now, obviously, if fertility is an issue, if you're still needing to get pregnant, then obviously the hysterectomy, removing the uterus, is not an option. The key thing that we do nowadays is what is called laparoscopic keyhole myomectomy, removal of the fibroid. So when you have a laparoscopic myomectomy, quite often you have a small cut in the belly button, another cut halfway down between the pubic bone and the belly button, and then 1 or 2 cuts on the sides. The doctor will put a telescope in via the belly button, will put instruments in via the other openings. We open the uterus, remove the fibroids, and then repair where we've removed the fibroids, and then we take the fibroids out through those small openings by what is called morcellation. There was a big furore a few years ago about morcellation and the risk of spreading fibroids, or if it's a cancer, spreading cancers. You need to check a couple of things before you consider laparoscopy for myomectomy. First of all, you do blood tests, something called a CA125 and something called LDH. And if these are normal, the risk of being a sarcoma rather than a fibroid is very, very low. The MRI is a gold standard, and anybody considering laparoscopic myomectomy must have an MRI to assess where the fibroids are exactly, so you can plan the surgery. When you do laparoscopic myomectomy, we do what is called in-bag morcellation. Basically, in that situation, we remove all the fibroids, repair the uterus, then we put a bag inside the abdomen. We take the fibroids, put those inside the bag, and then bring the bag out through the opening between the pubic bone and the belly button, open it out on the outside, put the morcellating machine inside the bag, and we take the fibroid out that way. So there's no spill of fibroids in the abdomen, if you like, and so there's no risk of any spread of malignancy or anything like that, should there be a malignancy. So it'll be exactly like having an open procedure, but your recovery is going to be 2 weeks rather than 6 weeks. In essence, if you're worried about fibroids, the first step is to get imaging done. From that, you'll know how big the fibroid is and where it is and whether or not it needs treatment. So the simpler thing is, if you're worried, see your doctor and get the imaging organized. Thank you very much.